And we are live. It's Dr. J in the house with Rob Edwards. Today, we're going to be talking about understanding infertility, the top 5 causes for infertility. And we're going to give you our take from a nutrition and functional medicine perspective of how we can work on supporting that so the body can heal and be more fertile. As fertility really is a byproduct of health. The healthier you become, the more fertile you become. So we'll be talking about some of those impediments and what we can do about it. Rob, how are you doing today, man?
Good. Yeah. Excited to dive into the topic as always. This is something that a lot of people suffer with. See actually quite a few people that struggle in this area. I think younger and younger, obviously we get pregnant at that age, but I think we're seeing a difference in sort of this generation, the past generations in terms of their ability to get pregnant, both with on the men's side as well as the women's side. So yeah, let's dig into this today.
Yeah, absolutely. So first thing is we kind of have to understand what a woman's cycle looks like. I mean, I'll pull up here, a female cycle, monthly, and we'll kind of go through what that chart looks like. And then just so we can plug in from a fertility perspective, what's actually happening. I think when you see that, it's like, okay, this makes sense. And we can use the physiology because really in the end, functional medicine is just physiology 101, right? Physiology, biochemistry, applied nutrition 101. And so if we can take that understanding and then say, okay, well, what's our intervention going to be? If it's not a drug, what are we doing to kind of move the physiology upstream so downstream we get a better outcome in regards to how you feel, not just symptomatic, changing with a medication. That's how we get healing. So we're gonna dive into that here right now. So first off, let's go look at our monthly cycle. Let's make sense of it. So first off here, you're going to see this is your uterus lining here. So this is day 0, right? Day 1 is we start to bleed. So when bleeding happens, this uterine lining, this endometrial lining starts to slough off. This is what's coming out, known as the period or menstruation, okay, right here. So typically it's going to be, 1 to 4 days, but it can go up to 7 days. And if you have an excessively thick endometrial lining, that can also be partly due to estrogen dominance. And so if we have estrogen dominance present, that can cause that to be a lot thicker. That heavy menstrual flow can also cause low iron, anemia, and that can cause lots of fatigue and mood issues and thyroid issues too. So on that note, we have the starting page, which is the menstruation. And then what happens after menstruation, right? We start to have this LH, or I should say our FSH starts to increase. So you can see here, day 0, it's starting to peak up just a little bit right there. FSH is causing this follicle upstream to grow. This is the egg. As that egg grows, and grows, we start to get a bump of estrogen. So the first domino really is menstruation. That is you. And then if we go back, right? So why did this menstruation happen? Well, if we go back here, so imagine this is the last cycle, right? We have this drop in progesterone, this drop in estrogen that happens at the end. That signals start sloughing off the lining. So now if we go here, we fast forward. Now we're at the beginning of next month. This is triggered by that drop in hormones of progesterone and estrogen the previous month. Then we have the uterine lining sloughing off. That's our menstruation or our period. By the way, it's a pet peeve, right? This right here is our entire cycle. But most women, I say, hey, how long is your cycle? They say, oh, it's 4 days or 5 days. And everyone in their brain goes right to menstruation when you ask them about a cycle. It's kind of a weird thing. It's happened probably a couple thousand times. So your cycle is the whole kit and caboodle, right? It's your menstruation, it's your follicular phase, it's your luteal phase, and then starting over, your menstruation is just your period time. So just a little fun fact there. So we have our menstruation followed by a rise in FSH. That's a follicle stimulating hormone. That's from the pituitary. That causes the follicle to grow. This is now happening in the ovary, by the way. Follicle grows. Estrogen starts to come along with that. Estrogen peaks around day 10 or so, 10, 11. That then causes this big spike in LH. LH then talks to the ovaries as well to start making progesterone. So you can see progesterone is this blue line. So LH comes first. So if we're running like, let's say a clear blue ovulation OPK strip test, this is what tests positive. And then a day or two later, progesterone comes up. And so where estrogen peaks and where progesterone peaks, this in-between time frame here is where ovulation happens. So you can see here, this egg is now released from the ovary. And this is now what's called the corpus luteum here afterwards. It literally means white body, corpus luteum, white body. So here's the egg. And then ideally what happens here is the egg either meets sperm, then that causes it to implant deep into the uterine lining and we have a baby down the road, or it doesn't, right? The hormones come up, progesterone, estrogen. Let's say we're not pregnant. There's no sperm there. There is no fertilization. Boop. we have drop in the hormones, and then we have that menstrual flow again. So that's a typical cycle. And a lot of times we have thicker uterine lining due to maybe endometriosis, or maybe more outside of the uterine lining, or it could be from fibroids or just estrogen dominance.
Mhm.
We could have progesterone falling out too soon, which could create lots of PMS issues, mood issues, energy issues, menstrual cramping issues, irritability issues. And so there's lots of different things, whether it's from estrogen dominance, low progesterone, which are partly connected, or poor detoxification issues. This can easily impact it. So if we don't have good progesterone, we don't have good cycle timing in our follicular phase or a luteal phase. Let's say the follicular phase is too short, a luteal phase is too short. Let's say we don't have the good timing of LH and progesterone and estrogen. We don't have that estrogen, LH, progesterone timing, then fertility is going to be a lot harder to happen. And again, we need about 28 days. If we have a luteal phase defect and that luteal phase tends to get shorter, we're going to miss out on that progesterone. And again, essentially, progesterone is progestational, right? Progestational. We need it to work on the implantation to get pregnant, and then also have that good HCG surge afterwards and keep that egg essentially stuck. Think of progesterone as the sticky glue that allows that egg to implant into that uterine lining.
Yeah, 100%. Yeah.
Questions on that? I know it's a lot there, but this just kind of gives you the overview, because when we start to see, let's say someone's stressed, let's say their estrogen levels are low. And again, you can be estrogen dominant and still have low estrogen, right? Let's say your DHEA is low. Let's say you have low progesterone because you're stressed. Because remember, progesterone can pinch hit to cortisol. So for very stressed and we're making lots of cortisol, we can easily lower progesterone. Progesterone opens those GABA chloride channels, so it allows for relaxation, chilling your brain out, sleep. So if we start to have sleep issues, mood issues, PMS, it can easily be from estrogen being out of whack, progesterone being out of whack. And then if we start adding things in like xenoestrogens, these are foreign estrogens, whether it's from birth control pills, whether it's from plastics, glyphosate, pesticides, a lot of those have a estrogen backbone to it. Pesticides do, plastics, and then, of course, other things like insulin resistance can all throw things off as well. I mean, insulin resistance is probably one of the number one biggest driving factors, because it impacts fertility by increasing androgens. And when the androgens start to go up, that can cause ovarian cysts to grow over in the follicle here, and which can make fertility much higher, or much worse, I should say. And it can increase, it makes prolactin a lot higher. So high prolactin can throw off the cycle, and then it starts to create inflammation in the ovary, because now you have all these cysts which can burst, and that makes healthy egg quality a lot harder, because these cysts can really impact healthy hormone signaling.
Yeah. I mean, it's like kind of just to jump in, even in terms of, you talked a little bit about the endocrine disruptors, xenoestrogens, those kind of things, but a couple of them just kind of right off the bat, from plastics perspective, we have BPA, right, from food or food packaging, things that we have exposure to, phthalates, parabens, which are found in cosmetics, right? These things are kind of giving hormonal signals that confuse the cells in the particular area of our bodies. And so that's what's going on, is we have some confusion, and we're wondering, well, why isn't our cycle acting normal? Well, plastics is one part of that. What are some of the other things that we could see besides that? There's also like heavy metals like lead, mercury, cadmium, right? That we've got a lot of exposures to, not even to mention like the pesticides or herbicides or industrial chemicals, household chemicals, pharmaceuticals, right? You hear about people all the time being on birth control for a long period of time. That's messaging, right, to your pituitary gland that it doesn't need to produce these hormones anymore. And so there's a lot of things that unfortunately our society is, one, exposed to, two, is manipulating, that I think contribute to this as well. So I'm wondering what your thoughts are about that, Justin.
Yeah. And so, of course, anything environmental. So you're going to have birth control pills can be a thing, because if we have this natural rise and fall of estrogen throughout the month, let's say we add a bunch of synthetic estrogen, whether it's, low estrogen or ethinyl estradiol kind of birth control pill. Now we have this super high level of estrogen. They typically are going to take it till about day 22, 23, then take your reminder iron pills after that. And so your cycle is now disrupted. We don't have that natural estrogen peak and then drop, and then high progesterone and then peak and then drop. We have estrogen high throughout the month. That tends to lower progesterone. We don't have ovulation happening normally. And then we have this super high level of estrogen, which causes our upstream hormones like LH and FSH to fall asleep. So it may go really low because these hormones are really high, with the synthetic estrogens, now these hormones go to sleep. Or let's say you have like a Marina or a Skylar or a Kylina. These are like synthetic norestrogel progesterones, right? It's the same synthetic progesterone that you make the Plan B pill out of, except it's just a lot lower dose and it's kind of like milk throughout the month. You have this like kind of coating and you reabsorb it daily. So now you have this super high level of progesterone throughout the month and you don't have any fluctuation. So you don't bleed, you don't slough off your uterine lining. At least with the birth control pill, you take a reminder pill for a few days, you at least can slough off that uterine lining. So now with these synthetic IUDs, now you can just spot throughout the entire month, right? And you don't really know where you're at and you're not really cleaning out that uterine lining monthly. So you have a lot of synthetic hormones that come in and that can screw up the upstream signaling with FSH and LH. And that can make it harder down the road when you come off these things to reestablish these good feedback loops. And so we look at things like adrenals. They play a really big role with everything, right? Because the adrenals, if you look, I'll try to zoom in a little bit more here. I'm going to try to get this a little bit bigger for you guys so I can get it on another page here. Hold on one sec. All right. Here we go. Yeah. So you can see here a couple things. So when we talk about fertility, one of the first things we look at is nutrition. So cholesterol and eating healthy animal products is important because that's the building block of all your hormones. So if you're vegan, you're vegetarian, or let's say you have crummy digestion, that can easily impact your fertility because the building blocks aren't there. Now, if we're chronically stressed on the adrenal side, not having enough DHEA, DHEA is the precursor sex hormone building block to actually make some of our female hormones, our estrogens, progesterones, and even male hormones. So if we're chronically stressed, DHEA can be impaired. And then also, too, is progesterone here. Remember, that's the progestational hormone. That's really important for healthy fertility, for egg implantation, but it's also really important for opening the GABA chloride channels and stress and relaxation. But progesterone goes where when you're stressed? It goes to cortisol. And so we can easily make stress hormone out of this, which can lower our progesterone and start to create more estrogen dominance. And so we have the dietary impact of not having good fats and proteins that can impact it. If we have poor digestion, maybe we don't have the hydrochloric acid or the enzymes, or maybe we have blasto or H. pylori. Maybe that impacts the absorption. And then you can see how DHEA and progesterone and cortisol interplay downstream. DHEAs are a backup generator of female hormone support from the adrenals. Progesterone is vital for progestational, but if we're stressed, we'll make cortisol instead. Our body is always hardwired to deal with stress and inflammation now to survive versus fertility and recovery is always put off tomorrow. The body will always kick the can down the road because you don't have to worry about that if you can't survive now. And so the goal is we want to send good hormonal signals of abundance, safety, anti-inflammatory, nutritional density now because that allows for fertility and recovery down the road.
Yeah, and I think that gets into the messaging of like a sympathetic or the fight or flight that we're talking about.
Yeah,
when we kind of think about that, our cells act independently from our knowledge, right? We have knowledge of what we're putting inside of our body. We have knowledge of what we're seeing, experiencing, feeling in terms of symptoms, but your cells don't. So if we put them in an environment where we're triggering sympathetic, which just means this fight or flight, it's going to act accordingly. Right. And this is the whole idea that you don't actually have to, it doesn't have to be a real stressor for your body to interpret it as a stressor. Right. So meaning it can be a fake snake, but it still scares you the same as a real snake. Either way, if we're tripping on those stress hormones, right, like the cortisols and whatnot, it's going to block DHEA from being able to come back in, which is going to rebuild. But it's also potentially going to start using your progesterone too. So I think this can play into some people where they get so stressed about we want to have a child, want to have a child, want to have a child. You're stressing your body out. Now we're tripping the sympathetic nervous system. And now all of a sudden the cortisol demand is there.
Bingo.
And you can't get pregnant. Or maybe you do, but you can't hold on to it because we need more progesterone production once you actually do get pregnant. So that's a super important piece that we're laying out here.
Bingo. So if we look at some of our big hormonal kind of causes, right, we're going to have things like FSH, LH issues upstream. Those are some of your brain hormones. That's the pituitary talking to the ovary or the gonads or the adrenals downstream. So that's a thing that can be impacted by stress. HPA axis dysfunction. So stress and inflammation can cause that feedback loop to malfunction, but also maybe lots of birth control, pills can do it because you have lots of very high dose of synthetic estrogen or progesterone at high levels, and it's not cycled throughout the month, so it stays high. That can cause disruption. And so when you come off a birth control pill, you can get what's called post birth control pill syndrome, where those feedback loops take quite a while to kind of reestablish. You could have things like PCOS. Probably the number one driver of infertility is PCOS, because you start to upregulate enzymes called 1720 lyase, which causes more androgens. And then that causes disruptions with prolactin, and prolactin can cause the cycle to go off. You can start to get acne, abnormal hair growth, ovarian cysts. You start to see elevation in testosterone. So all these things throw off the cycle. That's why the number one drug used to treat that is what? Metformin, right? What's metformin used for? Well, it's used to sensitize insulin, and it's first line therapy in diabetics or pre-diabetics. And so we know blood sugar and insulin, it plays a huge role. So diet makes a big difference. Also, low thyroid. So if we have low thyroid or Hashimoto's, which is the major cause for most thyroid issues, that's an autoimmune thyroid issue, has a major connection with fertility. And then if you look at Hashimoto's and gluten connection, gluten is responsible, if you're very sensitive, for spontaneous miscarriage. There's a lot of studies on gluten and miscarriage. You can go take a look at that in the peer-reviewed literature. So we have that component as well. And then, of course, we have just estrogen dominance. So if you have things like fibroid growth in that endometrial lining, that can be a inflammatory kind of component. It can also, let's just say, steal a lot of blood flow, because the fibroids suck a lot of the blood flow. And so if an egg goes to implant and you don't have good blood flow there, then you won't have the nutrients, and the inflammation can prevent that egg from implanting into the uterus lining. And if you have endometriosis, let's say chocolate cyst in the ovaries, which is a kind of endometriosis, or endometriosis, which is essentially uterine tissue, but it's growing outside the uterus. So it's, let's say it's on the ovaries, let's say it's on the outside of the uterus, or on the bladder, or on the intestines, right? Or on the colon, right? That can create inflammation, and it can make it hard to have fertility. You could have a lot of pain right at the start of your period. Those are all potential, vectors. So endometriosis too. And then the driving factor of that is going to be typically estrogen dominance, potentially a vector of birth control pill, plastics, pesticides, right? Lots of microplastics in the water. All these things can be driving factors. So our first thing out of the gate is clean water, organic food, keep your food away from plastics, no microwaves, use Pyrex. So we're trying to do foundational changes to get all those vectors of toxins out. And guess what? It's for guys too, because if you look at men's sperm count of the last 100 years, it's down, 50, 80%. It's down to under 20 million per ejaculation. Used to be at 50 to 80. So it's much lower. And so these kind of compounds can also impact guys' fertility, and plastics and microplastics and estrogens really impact that LH feedback loop. It disrupts it. And so when it comes to fertility, it's 40% on the guys, 40% on the gals, and then 20 is kind of the in-between stuff, right? We're not quite sure how or where that's happening. So we always look at the diet, and we always get guys dialed in as well, fertility-wise, nutrient density, anti-inflammatory, get all the toxins and crap out. Really important.
Yeah, and all the research is showing too, even with men, is that they're finding more and more of these microplastics inside of the testicles of men. Right.
Huge.
So now we're having another complete issue going on from that perspective. And, our condition, our environment plays a huge factor in somebody being able to get pregnant. And it takes an enormous amount of energy to get pregnant as well. It's not a small thing that we're doing. So your body's always going to preference protection before creation. And if we don't have the mother in good condition, and we don't have everything kind of working in the right place, right? Your body, if it feels like it needs to pull from any area of your body really, and support protection, it's going to do that, coming back to that sympathetic mode option. But we get a ton of these different stressors, again, the heavy metals, the plastics, the general toxicities that comes from the lotions that we put on our body, right? The air that we breathe, the EMFs that we have. And, I know sometimes this kind of feels inundating for people, but just kind of reimagine your life prior to, let's say, 100 years ago. Like none of this stuff would have been here, right? So now we have to address them because they are here. And our bodies we're just not conditioned yet. I can't remember what practitioner I first heard from them. Like we have what's the word I'm looking for? We have ancient bodies living in a modern world. And that's part of the problem, is we have so much exposure now so quickly, more than we've ever had in the time of human existence. And so we're seeing all kinds of things pop up, not just infertility, but that's just one talking point that we have going on with that.
Yeah, I want to hit what you just said real quick because you made a really good point on the microplastics. And so when we look at that, it's really easy to get overwhelmed. But there's one study here that suggests an average daily exposure of 382 plus or minus 205 microplastic particles per person. The big exposure is what? Drinking water, food ingestion. The total exposure per person was estimated to be 2012 plus or minus 600 microplastic particles per day. In addition, the daily mass exposure was calculated to range from 122. Okay. Particle shapes were characterized as fibers, fragments, spherical beads. All right. So the big thing is water and food. So what's the solution? So the big solution is, hey, if you got this BPA free plastic water bottle, guess what? It's not good. It's still got BPS in it.
Yep.
It's got phthalates, right? So get your plastic out. That's a big one. So use a glass bottle, or get some mineral water. If you're in an office setting, just
Yep.
I'll go through a case or two of my Topo Chico, maybe a case a week, or you can do some Mountain Valley. Mountain Valley's, a great kind of water, and they got it at more big brand box stores like Target and Walmart. So you can still get it, not that expensive, but water is really important. I mean, it is so
Mhm.
important. So use glass bottles, use an RO filter. There's a lot of microplastics. So these studies are looking at all kinds of exposure with toxins coming in. I think it was like a credit card or so per month people eat or something like that. It's
Yeah.
some
Yeah.
crazy
Something like
amount,
that.
right?
I've heard that too. Yeah.
It's some stupid amount. And so you look at your water, okay, you buy it from a reputable source that has reputation online. So good brands, Gerald Steiner, Mountain Valley, Topo Chico is good. The PFAS in Topo Chico was an issue a few years ago. It's come down a lot. So those are some good brands to look at. Get an RO system. So I have a couple that I like, but a good RO system will get a lot of the microplastics out. Plus, there's going to be pesticides in your water too. I mean, Texas Tribune 2018, half of Texas's water supply was above the EPA limit in atrazine, and atrazine is a hormone mimicker. So we want to get rid of the hormones in our water. And so water is a big one. Try to be more organic with your food. Organic will be big. It's not perfect,
Mhm.
but you'll at least have less pesticides. You can wash them as well. You can try to stay away from the dirty dozen and eat the clean 15. So the Environmental Working Group's got a good article on what those look like. Essentially, things with peels tend to have less residue. Things that you eat on the outside will have more. So, if you just Google dirty dozen, clean 15, you'll find an article on that. That's a good starting place out of the gate. And so get your water good and up. Use Pyrex. Put your food in Pyrex. When you heat it up, I try to use essentially a air fryer or convection oven. 400 degrees, 5 minutes. Better. You won't destroy the nutrients. But if you're putting something in the microwave and it's plastic, oh my gosh, you are liberating so much
Yeah.
plastic and so much xenoestrogen and phthalate in the food. So really use glass or Pyrex and try to use a convection oven to heat it up if you want that.
Yeah, no, and that's the thing. So the diet and nutrition first out of the gates. These are sort of entry level things, right? And then your exercise and movement. We want your body to be communicating. It also improves your insulin sensitivity when we're doing that. So, movement, exercise. I tell
Yep.
people to do a walk that's meaningful. I call it a metabolic walk, which is essentially pick a mile long and walk it faster than what you would normally walk. Like try, especially if they're older, you haven't exercised in a long time. At least gets the heart
Yep.
flowing, gets the muscles, the messaging coming back into place over the first 30 days. So that's another entry level thing that you can do to start to kind of move
Yep.
things in the right direction.
Yeah, exactly. So, a couple things out of the gate. So, we talked about a lot of the toxins. And again, in the toxins, there could also be heavy metals in there: cadmium, aluminum,
Mhm.
arsenic, mercury. So, staying away from a lot of those is going to be key. And so, more organic, you're going to have better soil quality, less issues there. Stay away from the conventional food. It's going to be big. Eat more local. It's
Yep.
going to be key. A lot of your good cruciferous foods are going to be key for detoxification. So your broccoli sprouts, right? Your broccoli, your asparagus, your cruciferous, your cauliflower, your asparagus, great,
Mhm.
excellent. And then good proteins, right? Proteins and fats are going to have the building block for your hormones. They're going to stabilize blood sugar, and they're going to have the nutrients to run your detox pathways. They'll have the additional B vitamins. So that'll allow you to detoxify better and have better blood sugar stability. Blood sugar is the key with fertility issues because insulin and PCOS is one of the biggest drivers. You have to get your insulin in check. So we have that component. Now, just some simple things like lifestyle things. Let's talk about managing your stress, right? Whether it's movement, whether it's prayer, meditation, getting to bed, getting at least 8 hours, 7 hours sleep,
Mhm.
getting to bed on the other side of the midnight is key to really helping with healing, with recovery. Rob talked about earlier that parasympathetic, sympathetic response.
Yep.
Parasympathetics, the break, the slow down, the repair, the recovery. The sympathetic is the gas, the go, 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 go. So we want to be on top of supporting parasympathetic so we can repair, because your body's either going to be breaking down or building up. And the more we can send parasympathetic signals, the better you'll heal and the greater chance of fertility being active will appear.
Yeah, and there's a little bit of, I think, brain rewiring that goes into that. Like, we live in a, if you're living today, you've got temptation in the middle of the night to get on your phone and start scrolling. Let's say
Yeah.
somebody's kind of wanting to have a baby, get pregnant. They're probably going to have interest in studying that, saying, what am I supposed to do? What am I not supposed to do? And that can become an issue, right? Because your brain is starting to think now at night what I'm supposed to do. I've rewired it now to think I'm supposed to actually go on my cell phone and start to look up information. And even though it's interesting and everything else, you need to start to create those patterns of normal circadian rhythm. Once the sun goes down, we're supposed to be shutting down, and so getting low level lights
Yep.
in the house, maybe turning off
Yep.
anything producing EMF, and reading a book versus reading, scrolling through your cell phone, because that's designed. If you're on social media, it's designed to give you a dopamine hit, and that's going to keep you up
Correct.
during the night, and it's going to confuse your hormones. It's going to confuse your body. So melatonin needs to come in. The things that need to come into place need to come into place at night.
Yeah. Yeah. Get your lights on, dimmer switches, maybe get some blue blocking glasses that you can wear at night. Those are all good things that, so if you're going to be on your phone, you can at least mitigate that and give yourself that hour of time before bed so you can be getting to that parasympathetic state. All right. So we hit some of the lifestyle things. That's key. Walking, a little bit of exercise. Just make sure exercise allows you to feel good. If it's resistance training, if it's yoga or Pilates, make sure whatever you do, you feel better at the end than when you started. And you can just adjust the frequency, intensity, duration so you feel good. Next, microbiome, right? Gut health is so big, right? Gut health plays a big role because good gut function impacts making enzymes and acids and bile so you can break down all those good fat soluble vitamins, cholesterol, protein. But also our microbiome plays a big role. That's where 80% of our immune system lives. And because women are so prone to autoimmune issues, whether it's autoimmune thyroid, etc.,
Mhm.
right? Estrogen makes women more susceptible to autoimmune issues. It throws off that CD8, CD4 immune ratio. And so that's why you see 5 times more Hashimoto's, right? Most common thyroid issue in women than men. Now, I actually have Hashimoto's myself. And so you see it in guys quite frequently, but that estrogen can really throw things off. And so you got to be on top of that because thyroid and autoimmune can play a big role. And the gut is the biggest part for that. So the gut's important for our enzymes, our acids, our bile support, also our microbiome. And that's where we also synthesize nutrients as well. And if we have, good B12 and good let's say folate and good vitamin K2 from our microbiome, that's going to help us. And those good nutrients are going to feed beneficial bacteria as well. And also, if we have gut permeability, that's where most autoimmune conditions start, as they start in the gut, right? Metchnikoff, so he said life and death starts in the colon, right? So we're talking about the gut here in general, but gut permeability is going to increase autoimmune issues. That high level of zonulin, open that gut lining. Now our immune system is exposed to proteins it normally would not see, which then increases molecular mimicry, which is our immune system tagging those things and then attacking other surface tissue in the body that looks very similar. So we really want to be on top of our gut health too.
Yeah, and then what's sitting right underneath the immune system is your bloodstream, right? So that's why a lot of times we get things, once things get through your immune system, they get through your gut, you got leaky gut. Second place gets through your immune system gets backed up. Now it's in your blood. Once it's in your blood, where's it going to go? Well, anywhere. Where does your blood go? It can go anywhere. And where we have weak spots is typically where these things will take advantage. If we're talking about heavy metals, a lot of neurotoxins, a lot of those are going to go up to the brain and create issues, right? If we're talking about glyphosates and those kind of things, the thyroid tends to be sensitive to that, some of that kind of stuff. We could see skin rashes come out in people. We could see, really anything and everything could come out at that level, but also now your gut's compromised. We could be exposed to mold, and that's going to affect us more. Viruses, UV lights, all these other things that create stress and oxidation on our cells are more easily able to do it once our body's compromised. And to Justin's point, it all starts in the gut. That's why that's one of the first places we look at for most things when people come in to see us.
Yeah. So we talked about digestion, nutrient synthesis, gut permeability kind of being the big promoter of autoimmune issues, healthy bacteria, and synthesizing nutrients.
Mm-hmm.
And obviously, too, is that's where we absorb our nutrition. So you can have a great diet, but if we're not breaking things down, then those foods don't get broken down into those peptide-like molecules that we can absorb well. And so that's where we have to break everything down and absorb. So if we have poor digestion, our diet may not be optimal. Our diet could be great, but we're not getting those nutrients in. So that's a component too. And then obviously motility. We detoxify via the gut, right? We have to have good, healthy bowel motility so we can move everything out into our stool. And so if our bowel motility is off, now we start reabsorbing and having this auto intoxication factor. So now we're reabsorbing dysbiotic microbes, lipopolysaccharides, endotoxin,
Yeah.
mycotoxins, maybe even metals. All these things have to get moved. And also, too, we've talked about it in previous podcasts, but dysbiosis which is this imbalance of bad bacteria to good. So beneficial probiotics should be, more predominant. When we have more bad bugs, that can throw off, create this what's called dysbiosis, just more bad than good. But things like estrogen increase, I should say, dysbiotic bacteria in make this enzyme called beta glucuronidase. So this enzyme is vital for detoxifying estrogen. And so when it's really high, it comes in, it takes conjugated estrogen, it's already bound up, it's ready to be escorted out of the body, and it takes it breaks the handcuffs and allows that estrogen to go back into the gen pop, back into the circulation. So we have conjugated detoxified estrogen, bad bacteria makes this beta glucuronidase enzyme, which then takes estrogen and allows it to go back in circulation. So you can create estrogen dominance. You can further create it with bad gut function, with this imbalance in bad bacteria in the gut.
Yeah, and even to like double down on that, like if we follow down the stream and now we get to the liver, right? We're talking about liver congestion. That if your liver is backed up, same kind of thing is going to happen. Is you're going to have an overflow of all of these things that your body's trying to get rid of. Your liver, well, it does a lot of synthesis. It synthesizes as well, but the other thing that it does is your filtration. So it's cleaning out the blood. It's trying to get this stuff out of your body, either through the kidneys or it's going to go the intestinal tract route. Let's say somebody has constipation. Well, that's a problem because everything we're trying to get outside of the body is just sitting there and can recirculate in and around the body too. So, so the whole system, the gut, liver, gallbladder, all these things have to be working in order for you to get the nutrients and also to get out the things you need to get out, including hormones that have already been kind of used in terms of estrogens and things like that as well.
Excellent. Really good. All right. So we're trying to hit, there aren't a
Wow.
lot of people that connect everything to it, right? So we're trying to connect everything.
Yeah.
Now, let me just kind of go back and just talk about where conventional medicine shines a little bit. Because just to be straight with you, conventional medicine is going to ignore most of this stuff. Where conventional medicine is great is, hey, how is the piping? How's everything looking? Do you have
Yeah.
fibroids? Do you have endometriosis? Do you have ovarian cysts? They're really good at picking those things up. So a good, hysteroscopy or a good transvaginal ultrasound could be helpful.
Yeah.
Maybe even a hysterosalpingiogram to see if the fallopian tubes are open and patent and make sure everything's moving. So all those things can be helpful just to make sure there's nothing physically in there, fibroid tissue, endometriosis, cysts. It's the big things that can impact it. So it's good to get those looked at. Usually conventional medicine will look at FSH or estradiol, usually around day 2 or 3, or they'll look at AMH, which is a compound made by the ovaries and gives you a pretty good window at fertility and egg quality. And so AMH, I think you really want closer to 1 or so, 0.7 to 1, and that will tell you how your egg quality is. And so that can, help you know if maybe that egg quality is dropping. There's different things we can do to improve it. We can do things like maca and DHEA and CoQ10 and good quality fish oils and good quality fats and make sure toxins are down. So we can do things to improve that egg quality over time so it does get more healthy. Conventional medicine typically doesn't jump on that as much. Some more progressive repro OBs understand CoQ10 is important. They've seen studies on that. I've seen studies. NAC can be very helpful for egg quality and also preventing miscarriages because miscarriages are common in that first, if you have that risk, it's a common cause of infertility. If you've gotten pregnant before and then you've lost the baby in the first couple of weeks, right? It's really easy with low progesterone to drive that up, and then not having good NAC. NAC can really help with that egg implanting well and helping with the oxidative stress around that egg so things work better. And also, too, there can be slight autoimmune stuff happening where maybe the body's attacking that and that tissue. And so having a really good diet that keeps the big autoimmune provoking foods can be helpful, making sure your vitamin D is good, making sure we're cutting out like the gluten and maybe even the processed dairy and the flours and grains, because that can keep our autoimmune kind of response more under wraps, if you will.
Yeah, and a lot of that's because when we're talking autoimmune, you're already damaged as it is. And so any little thing can cause a flare up, or cause another condition or issue. So
Bingo.
the goal is to start to reduce inflammation, reduce the kind of damage, get this stuff outside of the body. So really, from a high level perspective, we're talking about one, that your body can absorb; two, that you're eating the right things that needs to be absorbed. I mean, if you're not eating them at all, you can't absorb what you don't eat. Second thing, are we absorbing it? Third thing, are we able to get rid of the things that shouldn't be in our body? That's really, toxicity, deficiency, absorption, excretion. That's kind of what we're looking at from a large level picture. And then we're just dancing around this subject in terms of all the possibilities that it could be in terms of a web. But yeah, this has been really good, man.
Yeah, really good. Let's keep on rolling. So
Yeah.
we talked about the gut health. Now we talked about autoimmune stuff,
Yeah.
right? There could be some genetic issues, some genetic predispositions, right? Just having inflammation, right? Just being inflamed. That's going to essentially put your body into a more fight or flight. It's going to take progesterone. It's going to bring it downstream more to cortisol. It's going to make your body in a less rebuilding state, less catabolic. So you're not going to have a lot of these nutrients that there to build you up. Women that are trying to be more low fat, right? Vegan vegetarians are going to have, being anemic, low iron, low B12. You're not going to get these in animal product, in plant-based products as much. You need the hand-based iron. You need the quality B12 from healthy animal sources are going to be what you see. I see vegan vegetarian patients very low in a lot of these nutrients, whether it's on a CBC, a ferritin, methylmalonic on an organic acid, or an intercellular nutrient panel. We see these nutrients low. And so inflammation is vitally important. We talked about autoimmune stuff and gut lining, gut permeability.
Mm-hmm.
We'll run hormonal testing. We'll see what a month-long cycle looks like. We'll look and see where the hard luteal phase looks like on day 20. We'll look at estrogen detoxification. Like we'll look at 2-methoxy, 2-hydroxyestrogen levels to see how we're metabolizing our estrogen.
Mm-hmm.
Maybe our glutathione's low. Maybe our B12 and methylation's poor. Most people have MTHFR issues, so that could impact B12 and B6 and folate and your ability to methylate too, and that can impact detoxification as well.
Yeah, absolutely. Yeah, no, that's 100%. And I think that's piece too is like that sometimes there are genetic factors, and that's kind of what you're getting into, where sometimes the traditional side shines a little bit. Are there some specific things there? But in terms of pushing the needle with the natural things going on inside of your body, and that's what we'd be looking at first, and then we can also assist that in some of the other things that Justin was talking about in terms of the testing, figuring out what's working right, what's not working so well. Or we can do something like when he's talking about the estrogenic pathways, we can look at like a Dutch test or something like that, which gives information in terms of what's actually going on. How are you metabolizing this stuff? Because it's one thing to put it in your body. It's another thing if it's actually using it, and what is it doing with it when it's using it? Those are two consideration pieces. And some of these pathways, we don't want estrogen to go down. There's sort of an alarm in terms of potential other chronic issues that we don't want to see happen later on.
Yeah, I think we hit some good stuff. If you guys want to reach out to Rob, Heritage Life or heritagehealth.life, we'll put the link down below so you guys can see it, heritagehealth.life. Reach out to Rob. Rob sees patients all over the U.S. as well. And myself, Dr. J here, justinhealth.com as well. Please put your comments down below. Love to see what you guys are thinking. We'll be responding. And again, if you have some good comments, we'll definitely use some of those topic recommendations for new content coming your way. So there's a lot of things here. It's easy to get overwhelmed. Again, start at the basics: food, water, keep toxins down. And then you can always go deeper with a good functional medicine person to look under the hood and get your hormones looked at. Maybe do a more functional fertility test. Maybe look at your gut. Make sure everything is going good from a xenoestrogen toxin exposure. And then we can also look at other nutrients to build up egg quality, support healthy progesterone levels, work on that HPA, HP gonadal axis, to work on that good brain signaling to really make fertility, be at your highest level possible.
Yeah, and I think that's the thing, right? So if you're looking to get pregnant in the next, either now or you're looking to get pregnant in the next 6 months, year, or whatnot, comment, let us know, right? And if you're having difficulties right now, and you don't want to go like sort of the IVF route or some of those other kind of things, try some of these things first, because I think a lot of people can have a lot of success just putting these things together first and foremost, and having success with that. So.
Yeah, even if you're at a place where you're like, well, I may have to go IVF because of my age or wherever else, either way, you still want to be as healthy as possible when you go into
Yep.
pregnancy, because the goal isn't just to get pregnant. It's to have a healthy pregnancy for you, healthy pregnancy for your baby, have a healthy birth. And all of these things, the more healthier you are, the better everything will work. And so you can say, well, I'm going to go do IVF anyway, but that's not a guarantee. Like filling you up with Follistim and Lupron
Yep.
and manipulating your cycle and getting you pregnant, that's just a small part of the journey. You want to have a super healthy pregnancy and grow a super healthy baby too. So you want to hit it from all sides. So even if you're like, I may go that way, it's still going to be important to incorporate these principles as well.
Yeah. Great point, man.
Awesome. Very good. All right, guys. Nice chatting with you all. Have a good one and love to see your comments below. Take care, y'all.